56 new cases of COVID-19 were reported on Tuesday after testing were done over the previous 24 hours, bringing the total number of to date to 2,356. The National Taskforce for COVID-19 Prevention and Control urged everyone to continue to comply with all the measures introduced by the COVID-19 Task Force to keep the virus under control.
กดพบผู้ติดเชื้อใหม่อยู่ในมือวันที่6 กรกฎาคมนี้ทั้งหมดแม่น56 คน
Speaking on behalf of the National Task Force for COVID-19 Prevention and Control, Deputy Director General of the Department of Communicable Diseases Control, Dr. Sisawat Sutanilasai reported 56 more cases of the COVID-19, bringing the total to 2,356. 3 of the new cases were reported in Vientiane imported cases. 1 in Vientiane provinces, Savanakhet recorded 7 imported cases. Champasak recorded 45, 44 are imported cases. The community transmitted cases 1 in Vientiane province and 1 Champasak province.
วันที่5 กรกฎาคมมีผู้เดินทางเข้ามาตามจุดผ่านแดนต่างๆสปป.ลาวทั้งหมดเป็น 2,533 คน
Dr. Sisawat said the increasing number of COVID-19 infections in Thailand, where the Delta variant is spreading, is causing concern that this more infectious strand has crossed the border into Laos. Some COVID-19 patients have been discharged from hospitals while others will remain in Mittapap Hospital in Vientiane and in Savanakhet, Champasak, and Lumpabang provincial hospitals until they twice test negative for the virus.
สายพันธุ์ที่ผู้เชี่ยวชาญให้ความกังวลหลายที่สุดในตอนนี้ก็แม่นมีอยู่4สายพันธุ์
According to Dr. Sisawat, the National Task Force has expressed concerns about emerging variants of the virus, as these have been shown to spread more rapidly. The new strands are also not as easy to detect using PCR tests, as a test results may be negative, but the virus can actually be present. People who arrive in Laos with flu-like or COVID-19 symptoms will be taken to a hospital for observation and asked to provide samples for lab tests. Everyone arriving in Laos without symptoms is required to self-monitor and take his or her temperature daily for 14 days. If going to a public place, they must wear a face mask. The government has extended the lockdown until July 19 and stepped up contact tracing and coordination between local authorities and health officials, as well as virus testing and vaccinations. In Vientiane and provinces with community-acquired infections, the owners of indoor sports facilities and fitness centers may apply for permission to reopen from the National COVID-19 Task Force or relevant provincial task force. Pubs and bars, karaoke clubs, entertainment venues, cinemas, snooker halls, massage parlors, spas, and internet cafes will remain closed.
การดำรงชีวิตปกติแบบใหม่รักษาระยะห่างทางสังคมใส่ผ้าอัดปากอัดดั้งเมื่อออกจากบ้าน
COVID-19 prevention measures such as temperature checks, social distancing, wearing a face mask, and use of hand sanitizers will continue in all shops and supermarkets, as well as at fresh markets and any areas of risk.
และบ่อนที่มีความเสี่ยง